The Congressional Budget Office estimates it could lead to 13 million more uninsured Americans by 2027 and a 10% spike in insurance premiums on the Obamacare markets. Joined now by Wendell Potter, a former health insurance executive and founder of Tarbell. That's a journalism website. And let me just ask you, first of all, here, what you expect to happen in the new year. The president, again, saying he suspects here that lawmakers are going to deal with health care when they get back to Washington, D.C. How optimistic are you that you're going to see lawmakers working together on health care here in the new year?
I'm not optimistic at all that they'll be working together. There still is some interest in the Alexander Murray bill, which is the bill that Senator Lamar Alexander and Patty Murray, a Republican and Democrat, have been working on. But there is waning support for the bill, at least among health policy experts who are not really sure that that bill, now that the tax bill has been passed, eliminating the individual mandate, would be helpful. It might even do more harm than good. And whether or not the Republicans have an appetite really for going deeper into or trying once again to change health care once again, I'm just not sure they'll have much appetite to do that.
And Wendell, you look at this law now on the books, the individual mandate gone as a result of this tax package, and the president characterizing the whole thing as dead or dying. What do you make of that characterization?
Well, there's no doubt that the law is going to be changing the Affordable Care Act, but in many ways the law will stay on the books, and a lot of the good aspects of the law that I certainly was supportive of are remaining in effect. The law requires insurers to take all comers. In other words, they can't discriminate against people because of pre-existing conditions, and there is no cap on how much coverage people will get from their insurance companies. And so there are a number of things that are very important consumer protections that will remain intact. We will see undoubtedly an increase in the number of people without insurance, and that's not a very good thing at all. We will see premiums begin to increase. Without the individual mandate, we also will more than likely see more insurers leaving the marketplace, getting out of insurers, individuals. So there's a great deal of uncertainty, but I think largely we'll see a lot of people who are uninsured in the future. Now, a lot more people, but there are also implications for hospitals. We likely will see an uptick once again in so-called uncompensated care and shifting of the cost from to people who do have insurance because of that so-called uncompensated care.
Last question here, a through line through all our conversations today has been this New York Times interview with the President of the United States. He was very excited in that interview about association health plans. For those who don't know what they are, what are they, and how are they different from traditional plans?
Well, they are plans that allow, theoretically, allow small businesses in particular to band together in an association to buy coverage. The problem is that there is the belief that in doing that they would be able to circumvent some of the benefits of the Affordable Care Act and offer coverage to workers that is very skimpy and would not be, in many cases, worth buying, and people would be finding themselves in policies that don't come nearly close enough to covering their needs if they actually get sick or injured. So they might have the appearance of offering more affordable coverage to people who work in particular for small businesses, but at the end of the day, the coverage is not likely to be very generous at all, and in many cases may be just the appearance of coverage.
All right, that's former health insurance executive Wendell Potter. Wendell, thank you very much.